The latest data from Safe Work Australia, published in 2015, estimates that more than 500,000 workers suffered workplace injuries in 2012-2013. The total economic cost of work-related injury and illness in Australia for 2012-2013 was estimated at over $61 billion, or 4.1% of GDP. Clearly, safety has a huge impact on Australian business and the Australian economy, and this is reflected in the significant increase in fines under the Model Work Health and Safety Act developed by Safe Work Australia. Legislation based on the Model Work Health and Safety Act is now in place throughout Australia, except for Victoria and Western Australia. Its introduction, as early as 2012, has caused many organisations to consider the adequacy and effectiveness of their safety management systems, particularly how they are complying with their due diligence requirements imposed on officers. This is because the new laws require officers to take an active, ongoing role in monitoring and managing work health and safety matters for their businesses. We know that taking into account the diverse experiences and opinions of companies and other organisations on the harmonised work health and safety laws will shed light on these matters that will assist businesses. And we have developed a survey to do just that. We have drawn together findings from almost 150 businesses from across Australia, both from the public and private sector. The responses spanned many industries across Australia. 64% of our respondents were either managers with work health and safety responsibility, HR managers, general counsel or in-house lawyers, or work health and safety specialists. About 1/3 of the respondents operated in dangerous industries, while another third were part of a global group of companies. There was also a good mix in the size of organisations covered by the survey. 40% of the respondents were from organisations with over 1,000 employees. 10% had more than 10,000 employees, and another 10% were from small businesses with less than 15 employees. Our survey found that the most popular method of managing work health and safety is through a work health and safety manager. Almost half of the respondents managed work health and safety in this way. The second most popular way of managing work health and safety was as part of the local HR function. Almost 1/3 of respondents managed work health and safety in this way. This may be a reflection of the fact that many respondents were from industries not traditionally regarded as dangerous industries. Even so, it shows the high expectation on HR managers and the fact that work health and safety managers are still a luxury for many organisations. Interestingly, none of the respondents said that work health and safety was primarily managed offshore, which shows an appreciation of the fact that managing work health and safety requires an understanding of local laws. This is an encouraging result. Also, none of the respondents said that work health and safety was primarily managed through the General Counsel in-house counsel role. Predominantly, therefore, work health and safety management is done via a work health and safety manager or within HR. In part, this seems in response to the changes to the legislation, with 14% of respondents saying that their organisation had increased the number of staff with primary responsibility for work health and safety due to the introduction of the harmonised work health and safety laws. From our experience, there is a significant diminution in legal risk for those companies and organisations that have work health and safety specialists, or for industries with low work health and safety risks that have a HR manager well versed in work health and safety. One of the key reforms under the Harmonised Work Health and Safety Act is that for the first time, officers have a positive duty to exercise due diligence to ensure that their organisation complies with the Work Health and Safety Act. Based on our survey, there is still some way to go for many officers to demonstrate due diligence. The definition of due diligence under the legislation has 6 sub-requirements. To avoid prosecution, an officer will need to be able to comply with each of those sub-requirements. We found that the main issue for officers is that in many organisations, it appears that the information about what the organisation is doing is not flowing through to officers. This will make it difficult for an officer in that organisation to say that they are monitoring work health and safety, even if the organisation is doing the right thing. Flowing from the survey, we recommend that organisations ensure that the good work health and safety information that is collected about the organisation gets to the board regularly and systematically. Over half the respondents felt their organisation's focus on work health and safety had actually increased since 1 January 2012. This is the date when the legislation based on the Model Act began to be rolled out across Australia. Significantly, no respondents felt that their organisation's focus had decreased over this period. Also, over 1/3 of respondents felt that the increase in the potential fines of up to $3 million per offence had led to an increased commitment to work health and safety. In our view, the large fines and the personal liability for officers have played their part in making organisations sit up and take notice of work health and safety. There is still a way to go on work health and safety harmonisation, according to our survey. While about 1/3 of respondents were satisfied with the progress that has been made in harmonising work health and safety laws, over half were hoping to see more progress. Other areas where there could be greater harmonisation include regulations that sit behind the acts and codes of practice that provide practical advice on how to meet work health and safety obligations. It is now widely accepted that one of the most effective ways that officers and senior managers can help to ensure a safe workplace is by creating a positive safety culture and acting as a role model. But our survey suggests that many officers and senior managers aren't seen to be taking a hands-on, active interest in safety or taking personal responsibility for promoting a positive safety culture. In addition, a significant number of respondents felt their organisation's frontline managers were not taking any positive steps to update their work health and safety knowledge, or the respondents weren't sure if those managers were taking those steps. If organisations and officers want to comply with the legislation, there needs to be more senior executives and boards leading the way on work health and safety.